It's Black History Month. Welcome, welcome, welcome. We are having a wonderful dialogue this month for Black History Month to honor our heritage, protect our future, and to celebrate Black History Month together and to really talk about something that's important, which is protecting ourselves from COVID-19. My name is Michelle Milam. I'm Crime Prevention Manager with the City of Richmond. Some of you may also know me. I am the Public Information Officer for the City of Richmond around COVID-19. And so I'm just really honored to participate in this dialogue today with some very important members in our community about COVID-19 and how we can work together. And this series is a partnership between Contra Costa County Health Services and the African American COVID-19 Working Group. We also have community groups that have been involved. The City of Richmond has been involved to bring this dialogue to everyone, to discuss something that, families are going to be discussing for the next several months, which is COVID-19 and the impact and the vaccine. The goal of this virtual conversation is really to promote COVID-19 safety, a sense of collective responsibility, and some spiritual insight using Kwanzaa principles like Ujima. So Ujima, just for those of you who may not know, is our collective responsibility. In this case, it's our collective responsibility to protect each other from COVID-19. And so I have a wonderful guest here today. I'm really excited to talk to him. And his name is Reverend Dr. Harold Orr. And I'm going to allow him to introduce himself and tell us a little bit about yourself.
Good afternoon, Michelle. I want to thank you for inviting me to what I think is a very important subject and a way to get the information out there. My name is Harold Orr, MD, Reverend Harold Orr, MD. I grew up in Richmond, California, in Parkchester Village. Went to undergraduate school at Howard University, and went to med school at UC San Francisco, and then went back to New York and did my training. Found my way back to California, was in private practice. I've had a really marvelous career in private practice. I've worked in corrections medicine, and now I'm doing hospice medicine. In the midst of all of that, I got a calling on my life, a clear calling on my life. I went back to theology seminary and got a master's in theology. And as the world would have it, as God would do it, I'm now the pastor of a church in the neighborhood, Parkchester, that was just right around the corner from where I grew up. And so that's where I am, that's who I am.
You're deeply rooted in the Richmond community. That's really obvious. I'm a Richmond homegirl as well, and I'm born and raised, and so I know how important it is to stay connected. And thank you for bringing back everything that you have done to the Richmond community. Our whole lives have changed, in the last year because of this virus, COVID-19. So how has COVID-19 impacted you?
Michelle, in three major ways, and there are a lot of other ways that I can think, but the three big things that I think about is one, myself and my family. Knowing in my age group that we are the high risk group. So I have a lot of respect for this virus. And my wife, who's a junior college professor, also, and my children, I've got into my children and grandchildren. So it's changed the way we interact with one another. We're not as open to people coming by our home as much as we used to do. And I'm very careful about the kind of things that I do and making sure I'm not bringing things home. That's one way. The second way is that the impact on my church. I was one of the first pastors to say, we're going to shut because it's unsafe for us to be gathering together. So that kind of goes to the Ujima principle, being responsible for others. So then what I've also done is I've tried to combine my worship services with informational questions at the end of the service. And I let people, whatever kind of questions they have, but a lot of them are around COVID-19. And there's so much information out there. It can be very difficult to decipher and give purposeful insight in it. So, and then the third thing is with my patients. I do hospice medicine where people are dying, and many of them have COVID, and helping them kind of go through and prepare for the end of life. That's the gift of having the medicine and having the spiritual combination, that I can call upon two different areas to help folks. And this has, it's been a significant impact on my healthcare career.
Wow. How do you see Ujima working to protect our community during this pandemic, as you described, when we have to take different kinds of precautions than we have? And how are you going to carry that principle of collective responsibility into the new year?
Well, I think one of the best things that I can do as a pastor and as a clinician is to educate people so that they understand. There's a lot of vaccination hesitancy in our community, trying to directly confront the kind of issues that people bring up about why they don't want to get the shot, or why they're concerned because of the history of the way the medicine in this country has done people of color. So critical to me is informing. I inform somebody, they inform somebody else, and making sure that the information that they get is good, solid information, and not something that you see on some of the social websites that have nothing to do with anything, that scare people unnecessarily. This is something that none of us have ever been through. The last time was 1918, and that it is just critical that we bring our brothers, we bring our sisters through. I mean, I want people to, if we've got something that will help, then I want them to get that help. And I feel absolutely committed and dedicated to that end, to help others, to educate others. One quick thing that I'll let you know that we did at the church, we had an opportunity to feed Parchester Village. And we had a feeding every Wednesday. And so there was a company that would bring some goods, vegetables and breads and things like that. When I wasn't that happy about the rounded nutritional value of the food. And then what we did was we actually went out and bought meats and rice and beans to make sure it would be a rounded meal. So that to me was a church stepping up to say, we're responsible to feed our brothers and sisters. And we did that.
I think that that's a really important piece of that collective responsibility, how you have worked with your congregation to answer questions. As there's a lot of different sources, as you mentioned, of information about COVID-19 and the vaccine kind of floating out there. So what sources of information do you utilize and you trust to share with your congregation and, that you trust in general?
Well, now, Michelle, I have access to things that the average person doesn't have. I get good medical journals, the Journal of American Medical Association, Journal of Internal Medicine. I have, their books that come out. I do not rely on social communications for any information about medicine. Occasionally, I will catch something on television with Dr. Fauci and things like that. But if you watch, some of these TV programs, there's so many experts, and sometimes the information they give is conflicting. And I'm fortunate as a physician, I can discern what I know to be real, what I know not to be real. But journals, some TV visual programs, some blogs I may listen to about medicine. Those are probably my primary source. And then doctors talk to doctors, and we share information. If I have a guy, I'm in internal medicine, but if I have a friend who's an infectious disease, I'll call and ask him a question and say, hey, look, tell me, what do you think about this? Does this make sense to you? So those kinds of sources help round and give me my base of information that I then dispense to those who come in contact with.
I think that's really important that you have those kind of discussions, and it's discussions that we're having, looking for information so people can make informed decisions.
Exactly.
So, I have a question for you will you take the COVID-19 vaccine when it's available? And what informs that process for you personally?
Michelle, I've already taken my first shot. My second shot is this Tuesday. What informed me, Michelle, when I took my first shot, that we had two effective treatments, the Pfizer and the Moderna. And I wanted to avail myself. What bothered me when I took it, it was what I had to go through to get the shot. Even as a physician, I had to kind of go through some stuff to get the shot. And I must admit, Contra Costa was really more organized in doing it, getting it out there than Alameda County was. And so the way I see it is I know what's available. I know what's out there. I know what they can do. And I'm going to avail myself of that, as it makes itself available to me and to others. I don't want to see, I was listening to something the other day about the percentage of who's actually getting the shot, right? And the fact that equitable, people talk about being equity. It has to be more than equity because we're the ones dying from this thing. So there has to be disproportionate numbers to me of us getting the shot of Black and brown people to fight this illness. This is a really scourge, and it requires, a different approach and a different modality than anything we have ever seen in our lives. And I really want to make it important and emphasize with people that I come in contact, this is not something to be afraid of. This is something that will save your life. It will save your life. And so, yeah, I've already had my first shot. My second shot is scheduled for February 9th. If they want a third shot, I'll do a third shot, if it makes sense, because of the way this thing is mutating.
Wow, I think you've really challenged us to think about this and to have these conversations, and that will be happening, in general for the next couple of months as we go through this process. So I really want to thank you and honor the work that you're doing. First of all, the work you're doing in clergy, the work that you're doing in medicine, everything that you've been doing to help support our community, and for being part of this conversation. It was really an honor to talk to you. And as we kind of think about UGMA and our collective responsibility to protect each other from COVID-19, we really want to hear from those who are listening too. For you who are out there who are watching this, we want to know, how are you having these conversations within your church, within your family, within your neighborhoods? We want you to share that information. You can share it actually online on social media. We even have a hashtag. It's called Flatten and Flourish. So Flatten and Flourish hashtag, you can use that to share how you are going forward with having these kind of conversations that we all need to be having with each other. And if you have any questions and you want to get good information, you can always visit the Contra Costa County Health Services website. There's lots of information there where you can inform yourself and family members about what's going on. And I just really think that this is an important dialogue that we're going to continue to have. And I thank you for being part of this series. So my name again is Michelle Milam, and I am signing off. But before I sign off, I want to remind everybody, wear your mask and show love from a distance.